Hello, everyone. This is Christian,
And this is Anna.
and today we're going to be talking to you about Tay-Sachs disease. So let's begin.
The topics that we are going to cover regarding Tay-Sachs disease include history of the disease, like when was the disease first found and who were the contributors, then the cause of the disease at the genetic level, the different types of TSD as well as its symptoms, different social groups that are at greater risk. We are also going to discuss the course of treatment, followed by current research, and finally, we will look at a case of a Tay-Sachs patient.
Starting with the history of Tay-Sachs disease, we go back to 1881, when the British ophthalmologist Dr. Warren Tay made an observation as he checked the eyes out of a 1-year-old patient. He came across the cherry red spot on the retina of the small kid, while at the same time noticed some progressive central nervous system degeneration, especially at the kid's mental and physical performance. Few years later, Doctor Bernard Sachs described the cellular negative impact caused by the disease in the patients who suffered. As well, he noted the pattern of inheritance in families and recognized the prevalence number in high number of cases from Jewish descendants. It wasn't until 1980s when the gene responsible for the disease, hexagene, was identified, and up to 100 mutations have been reported to cause the disease.
Tay-Sachs disease is an autosomal recessive inherited condition in which a child inherits a mutation on both copies of his or her hexosaminidase A or hexagene. The hexagene is located on the Q arm of chromosome 15. The mutation causes a lack of the enzyme hexosaminidase A being produced. The hexosaminidase A enzyme forms a complex within the lysosomes of cells that act to break down the fatty substance GM2 ganglioside. The buildup of these fatty substances damage the nerve cells in the brain and spinal cord by enlarging them, eventually rupturing them. This is why Tay-Sachs disease may also be known as GM2 gangliosidosis type 1.
There are three different types of TSD. The first one is called infant TSD. This type occurs at babies from 3 to 6 months old. In this type, patients experience central nervous system deterioration after prolonged cell rupturing, which then produces symptoms like cherry red spot at the retina, progressive loss of mental ability, blindness, increased noise reflex, progressive loss of hearing which may reach deafness, and lastly, seizures. Patients usually die by the age of 4. The second type refers to chronic TSD, which takes place during the ages of 5 years old until adolescence. For this type, the patients experience the same symptoms as infant TSD. The third type is known as late onset TSD, which occurs in adults in their early 20s and late 30s. This type of TSD may experience symptoms like motor difficulties when walking, bipolar disorder. TSD is possible to diagnose at the moment that an ophthalmologist observes the cherry red spot in the patient's retina, which is caused by the agglomeration of GM2 acids. The type of TSD depends on the type of mutation, since the mutation can either cause a defective synthesis of hexosaminidase A enzyme or no synthesis at all. This then impacts the degree of ganglioside GM2 accumulation over time.
Within the general population, carriers of the Tay-Sachs disease is 1 in 250 people. But there are certain areas that may have a higher carrier rate of Tay-Sachs disease. For example, in Eastern Europe, and this includes the Irish and British population, there is a carrier rate of 1 in 150. Jewish descendants have the highest carrier population rate at 1 in 27. To determine carrier status, blood testing may be performed to measure hexosaminidase A activity, and prenatal screening is also available.
In terms of the treatment, currently this disease has no treatment or cure available, especially for infantile, and chronic cases. However, patients may take anticonvulsant medications as a way to control seizures, but eventually patients will require a feeding tube to continue living.
In terms of current research, the National Tay-Sachs and Allied Diseases Association informs us of a minimum of 3 clinical trials. The first one is conducted by Queen's University. TSHA-101 is an adeno-associated virus 9 viral vector containing hex A and hex B genes to be administered via intrathecal injection. The second clinical trial is being done by Sanofi Genzyme. Basically, it is to assess whether the drug venglustat is efficient for treating GM2 gangliosidosis and other related diseases. And a third clinical trial is being administered by CO Gene Therapies. AXO-AAV GM2 is an investigational gene therapy that aims to restore hex A function by introducing a functional copy of the hex A and hex B genes. All of this ongoing research is on the recruiting process, and it seems that they will take a minimum of 5 years before any papers are published.
Alright, so up until this point, we have been telling you the characteristics that involve Tay-Sachs disease. But we think it's time that we show you an example of a patient that suffers from TSD. So in this video, you will observe a chronic case of a Tay-Sachs disease patient who is 7-year-old and lives in San Diego.
It is a rare, deadly disease with no cure, and now for the first time, the annual conference to support those suffering from Tay-Sachs disease is in San Diego.
10 News reporter Melissa Macias shows us one local family and their message of hope to save their son.
The Marquez family home here in Forest Ranch has turned into a hospital of sorts. Next to family photos, there's equipment here used to help Gavin on a day-to-day basis. It's a situation very few families in San Diego can relate to. For Jan Marquez and her son, it's a daily battle.
He's fighting every day.
7-year-old Gavin has Tay-Sachs disease. Marquez says he's only one of 3 children in the county with it, an illness that destroys the nerve cells. Gavin can't walk, can't talk, and eats through a feeding tube.
When you have a child with Tay-Sachs disease, especially as rare as it is, you're almost like living in a bubble. Nobody can relate to you. Nobody can understand you. Nobody can be in your shoes or want to be in your shoes.
It wasn't always this way. He was born seemingly healthy. But when his younger sister was born, they knew something was wrong. Turns out both Jan and her husband carried the Tay-Sachs gene. Gavin was soon diagnosed with a deadly inherited disease.
I felt like I died at that moment.
Thursday, the National Tay-Sachs and Allied Diseases Association began their conference in San Diego. These are the faces of the children with Tay-Sachs. The organization says only 50 kids are currently living with it, and all will pass away much too soon. Because it's such a rare disease, the funding is just not there.
Now we're looking at more than a year before clinical trials could start, and for our children, that's literally a lifetime.
The Marquez family says hope keeps them going.
Strength is within all of us, but sometimes some of us are in situations where you're forced to use it.
A fight for her only son's life. In Forest Ranch, Melissa Macias, 10 News.
That conference will go on until Sunday. To learn more about Tay-Sachs and how to help out little Gavin, go to 10news.com and click on the red television button.
In summary, Tay-Sachs disease is an autosomal recessive condition that is most prevalent among Jewish descendants. This disease kills central nervous system cells due to the accumulation of gangliocytes, which leads to progressive mental disability and seizures.
Infantile and chronic cases are fatal within 4 years due to the lack of treatment available to combat the disease. Groups at higher risk are recommended to get tested to detect carrier status in order to prevent unfortunate events. Current research is still years away from developing a treatment or even a cure for this disease. That is all regarding Tay-Sachs disease.
This is our work cited. Thank you so much for watching.